Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week ending Thursday, March 18th, 2021. As always, the first question is going to be, how is the pandemic progressing globally in the U.S. and in our region? And this week, I'm only proposing one additional question, which is, what can we learn from excess mortality? What is it? What can we learn from it? In terms of the pandemic, it's continuing to grow around the world, over 2.5 million deaths. We saw a 2% increase in the past week, which is the lowest week-to-week increase that we've seen, which is really good news. But it is important to understand that this pandemic is not over. Even at a 2% increase, we saw 60,000 deaths last week, which is over 6 deaths every minute. And if you look at the daily number of deaths in the world, you can see that two things. One, it looks like it may be maybe starting to level off right over here. But also, the number of deaths is actually still greater than it's been at any time except the winter time. So we're certainly not out of this yet globally. In terms of the United States, we've had 550,000 deaths and a 1% increase last week. And again, that 1% is the lowest week-to-week increase we've seen, which is definitely good news. But even at a 1% increase, we saw over 8,000 deaths last week, which is almost 1 death every minute. And again, if you look at the daily number of deaths, you can see that it is coming down pretty consistently. We're not seeing the leveling off yet that we're seeing globally, but even where we are, we're still about as we were in the summertime, and in fact, not quite as low as we were in the late summer or early part of the summer. So again, while we're pleased to see the pandemic moving in the right direction, it is definitely not over for us. August, September, October, November, December, January, February. And this is where all the cases have been as of March. And you can see there are a few states that have been particularly heavily impacted, like the Dakotas, like Arizona, but also like Tennessee. In terms of the states in our region, the number of deaths varies, of course, but our population does as well. So we look at deaths per million. Both South Carolina and Tennessee continue to have about 50% more than their neighboring states. And again, relatively small week-to-week increases. We've been following this strange progression in Virginia, where a couple of weeks ago there was a 17% week-to-week increase, then a 12%, then a 5%. Now it looks like it's back to about 3%. So hopefully returning to some normal rate of growth, that we don't quite know what happened here. In terms of the ballot health, the 21 county service area, 1,950 deaths, a 1% increase in the past week, about what the rest of the U.S. is. But again, remember, that's still 20 deaths last week, or almost 3 deaths every day. So while we're pleased to see the pandemic slowing down, there is no reason to believe that we're out of the woods yet, and no reason to believe that this pandemic won't recur if we're not careful. Now, this question of excess mortality has come up a couple of times. Some of the folks who view these videos have asked about it. I was asked about it when I spoke to the Senate Health and Welfare Committee. So I want to pose 2 questions. What is excess mortality, and why is it important in terms of the COVID-19 pandemic? Excess mortality is this idea that you can look at the number of expected deaths, and if you see an increase in that number, you have excess deaths. So this is a chart produced by the Centers for Disease Control back in October of 2020. The red line here is what we would expect in any given week. So you can see back in January, in the average January of the last few years, we've had a little less than 60,000 deaths. That number drops down over the summer and then starts to creep back up in the fall. That's what we would normally expect. But the CDC reported all of those deaths as excess deaths. So as of in October, the U.S. had 299,000 excess deaths or excess mortality, and about 2 out of 3 were probably due to COVID, but the other third were not. And though it's a little hard to see here, this is what we just, This is what we just saw, then spiking, and then through September, October, and then just to show you that it increased again through January. If you look at the week-to-week number of excess deaths, you can see that pretty much every week from late February into January of this year, we've seen excess deaths in our country. Now, why is this important in terms of COVID? It's important for a couple of reasons. One, early on in the pandemic, there were folks who were saying, look, most of these COVID deaths are just deaths due to something else, that we just call them a COVID death. The classic story is supposedly a guy's in a car accident. He's rushed to the emergency room. He tests positive for COVID, but then he dies because of his car accident, but it's called a COVID death. Well, if that's true, then there would be no excess deaths. What we're doing is simply renaming a death. So if someone dies of heart disease, but they have COVID, we'd call it a COVID death. If that were true, we wouldn't have excess deaths. The fact that we actually show and document excess deaths is evidence that we are in a pandemic. We are seeing something unusual. But there's another and more important thing we can learn from excess deaths. So in the US, according to this particular report, we saw 17% deaths above what we would have normally expected. That's about 385,000 excess deaths. Of those, 316,000 were classified as COVID deaths, and that leaves 68,000. So this idea that the excess deaths may be due to multiple different things. So some are unrecognized COVID deaths. It's important for us to know this because we need to know what to look for. If people are dying of COVID and we don't know it, we need to figure out why. But much more importantly, there are people who are dying because of indirect effects of COVID. People who don't seek care because they're afraid to go to the doctor. People who lost their job, can't afford food. There was an estimate in the American Journal of Public Health that there may be as many as 30,000 deaths because of loss of employment. Right. Substance abuse, we know, has gone up, suicide and others. And then the thing that we don't really know yet is whether we're going to see excess deaths from the so-called long haul, the long-term impacts of COVID-19. So it's really important to follow excess deaths because it tells us, again, how the extent of the impact of the pandemic and whether we're understanding and we know the causes of that impact. The more we can learn about why people are dying during COVID and from COVID will help us prepare for the next pandemic. So the global pandemic is slowing down. I do not believe that we are out of the woods yet. I am very concerned about a resurgence as we're seeing in other countries, particularly in Europe. And one of the ways we can follow progress is by understanding and responding to excess mortality. A great deal more information about COVID-19 on the College of Public Health website. If you'd like to be added to our mailing list, please let us know. I'd like to thank Melissa White for helping collate the data and Dara Young for editing, producing, and posting these videos. As always, I'm very interested in your questions, and I'd also like to hear from you if these videos are helpful to you or not. I look forward to hearing from you. Thank you very much, and be healthy.